Hôpital Montfort was founded in 1953. It is a French-speaking teaching hospital offering quality healthcare services to French and English-speaking patients in the Ottawa area, which is the capital of Canada. A few years ago, we underwent a major expansion phase. We doubled the number of beds, we increased the scope of services offered at the hospital, and we doubled the number of staff members. So this is a great opportunity, but also it comes with some new challenges.
One of our strategic goals at Montfort to improve the patient experience was to eliminate all waiting time for a patient. So we looked at the surgical flow with all the stakeholders and realized that the bottleneck was the operating room. We were spending half our time in non-clinical activity or time between two patients. So we thought that the SMED technique would obviously help us decrease the time between two patients and thus help increase our capacity in the OR. The lean methodology is the approach we chose at Hôpital Montfort to improve our patient experience. It goes along with our values such as compassion, excellence, respect, and engagement.
The benefits of this program to the patients has been significant. We have been able to gain 60 to 120 minutes of pure surgical time every day in every operating room. As a result, for elective patients, what this means is that we've been able to perform more elective surgeries than we did previously, using the exact same human resources in the operating room. This has resulted in patients not waiting as long for their surgeries and has reduced the number of patients on surgical wait times.
The Lean Surgery Project has benefited myself and my team in particular in relation to the choreography that occurs within the OR suite when we are preparing our patient and going through the surgical process. Using the Lean methodology, we were able to create what we call standard work. What it creates is an increased level of responsibility and accountability for each member, an expectation of what the other person is supposed to do, and all of that together is what creates the choreography.
We partnered with Fujitsu America on this project because we really felt that we wanted to ensure the consultation, the direct consultation, and the ability to be advised through this project that was very, very complex by experts that had done it. We knew that there were consultants like Fujitsu America that had that experience and that they could bring us to our end point. Change management is a very complex undertaking in any setting, but particularly in a hospital. We find that it creates a lot of energy, and we wanted to make sure that that energy was positively channeled into the improvements. And we had recognized that a company like Fujitsu America brings a wealth of resources that we wouldn't have access to, and it would save time, it would ensure accuracy.
The Lean Surgical Initiative has allowed different members of the teams to collaborate and work together at making the patient's experience much more efficient, and also by maintaining the quality of care that we aim at all the time. Therefore, we have surgeons, we have surgical assistants, anesthetists, nurses, all working together, including the operating room cleaning crew, to make sure that we're well coordinated and that we can get as many patients as possible within an allotted time. So better collaboration, better patient care, and more efficiency. That's wonderful.
We found that the Fujitsu consultants not only have expertise, but they have an attitude that matches with our expectations. That made us very confident in undertaking such a large transformation in our hospital.